I welcome everyone. I'm delighted that you could join us today for a conversation between Marion Nestle and Marion Standish, two national experts in food policy and food politics. I'm Susan Hoffman, Assistant Dean of Lifelong Learning at UC Berkeley and the Director of the Osher Lifelong Learning Institute. Um, Ollie offers conversations and presentations on critical and urgent issues of the day, as well as field trips, travel programs, and a myriad of ways to build our learning community between campus and, frankly, and increasingly across the country. Today's conversation will be relevant in so many ways with two activist leaders who can describe how it is as well as what's at stake. Stake, that's a pun. Okay, we will record our session, caption it, and make it available to all of you on YouTube and perhaps a Berkeley podcast. Please post your questions in the chat. And then let me say a few words about our esteemed conversants. Marion Nestle is a Paulette Goddard Professor Emerita of Nutrition, Food Studies, and Public Health at NYU, and one of the nation's leading voices on food policy. Her career spans academia, government service, and public engagement, including work as a senior nutrition policy advisor at the U.S. Department of Health and Human Services. Dr. Nestle is the author of influential books such as Food Politics, Safe Food, and Soda Politics, and quite a few others. You'll hear about more today. And these books examine how industry, politics, and science actually shape what it is we eat. Marion continues to write and speak widely on nutrition, health, and food services and food systems. We are really happy to have you with us today. As is, happy to have Marion Standish back again. Law degree, master's. Marion is a nationally recognized leader in food policy, public health, and health equity. Formerly a senior advisor at the California Endowment, a vice president, executive vice president, the California Endowment. She directed major initiatives focused on healthy food access, obesity prevention, and community health. She's also the co-founder of the California Food Policy Advocates, where she led research, advocacy to improve nutrition programs for low-income families. With a background in law, philanthropy, and grassroots policy work, Standish has helped shape state and national efforts to advance equitable food systems and community-driven health solutions. So with that, I know these bios do only a thumbnail sketch of what you both stand for and do. But Marion, can I turn it over to you and get the conversation started?
Sure. Thank you, Susan, for that generous introduction. I think we both really appreciate it. And I just want to welcome Marion back to Berkeley, even though we're on Zoom, and hope that we can see you here in person. I hate to tell you, but it's unseasonably warm today. So I don't know if you're cold, but we're kind of warm over here. Anyway, I'm really excited to host this conversation with you, Marion, not just because we share the same spelling of our names, which parenthetically is kind of unusual for women because the O is usually related to the male spelling and not the female spelling. And, at some point we can go into why our parents did that. But because you have been such an important influence in my career. And I really want to say to everyone listening and credit you with providing not just me, but many others, and maybe some of whom are on this call, with the analysis, with the language that we were looking for, that we needed to reframe the conversation on food and nutrition from one that really focused strictly on personal choices and individualism to one that included a much broader discussion about policy, about systems, and corporate control. I think we really learned uh, at your knee how to talk about these issues and how to tackle them. So really kudos and thank you so much for, what I consider having had a great career focused on the issues of health and nutrition and equity, which, I think we will get to during our conversation today. So, thanks for all this work and continued advocacy. We really both are looking for a food system that is organized to meet its intended purpose. Its intended purpose for me, I always thought, was nourishing and helping support a healthy population. I think it's a goal we're still pretty far from, I hate to say. So let's get into it. And I thought I'd just kick it off. We know you have a new book, What to Eat Now. I see it kind of over your shoulder there. I just want to say I have the original, What to Eat, which was pretty substantial. And what was important to you about writing this new book? Why did we need a new, updated version of What to Eat Now? What is new? What's changed? Why is it important?
Well, first of all, I'm delighted to be here, and it's so much fun to be talking to you. We go back a long way. This was a pandemic project. And during the pandemic, I was sequestered upstate New York in Ithaca, where things are much quieter than they are in New York City. And I needed some kind of a project. And I proposed to the publisher that I updated. I looked at the book. I thought, gee, this really reads like a timeless classic, but it's a little out of date. And and I proposed to the publisher, a just quick updating of it. I wouldn't change the number of pages. I wouldn't change the content. I would just update the examples and references and that kind of thing. And it certainly wouldn't take more than 6 months.
Yeah.
And here we are 4 years later. And I have never underestimated the amount of work in a project that I needed to do as I underestimated this, because I had not been paying very close attention and a lot of things had changed. And some of them are obvious, really obvious changes. When I wrote What to Eat in 2006, the supermarkets had full aisles of Coke on one side and Pepsi on the other. Now it's all bottled waters of one kind or another. And that's what you see when you first go into the store, is mountains of bottled waters, fruit flavored, the store branded. The increase in store branding has been enormous. The introduction of the term ultra processed has changed the way we think about food, supermarket foods. The introduction of no labels, no gluten, no high fructose syrup, corn syrup, no GMOs. You could go on and on and on with the no's. The widespread availability of organic foods, which was not true 20 years ago. The entire reorganization of supermarkets to make room for the packages that have to be collected for people who are doing online shopping, an enormous change. Whereas the basic underlying purpose of a supermarket remains the same, which is to sell as much food to as many people at as high a price as possible. And that's the same goal of food companies, which are not social service agencies and not public health agencies. They're businesses. And so it's the focus on the business aspect that this book is really about. And it's not a book about what you should eat. It's a book about how to think about food issues, of which there are many. I went around the supermarket aisle by aisle again and rewrote every single, the publisher had wanted a 40% update. It's a 90% update. I mean, it's basically a new book. And it's longer. I'm so embarrassed. It's 700 pages. And my joke about it is that Michael Pollan could do it in 7 words. Eat food, not too much, mostly plants. I took 700 pages to do the same thing.
Well, that's a kind of interesting, Marion, because just picking up on the Michael Pollan and of course what your recommendations are in what to eat and what to eat now. I mean, I think these recommendations have remained pretty constant, for many years. And we do try as consumers, many of us, to follow those kind of suggestions, but they're incredibly difficult. And I wonder if you could talk a little bit about, what makes it so difficult? Why is it so hard for us to eat this very simple, straightforward diet, which will in turn reduce chronic disease and help us stay healthy? What is it about the food system, I'll say, or the what you like to call the food industrial complex,
Actually,
that makes it so hard?
it's what President Trump calls it.
Yeah. What makes it so hard? I mean, if we just go into the supermarket, and I love how I learned so much about what the supermarket does, what that business does to our choices from your writing.
Well, the way I put it is that if you go into a supermarket trying to make healthful food choices, you are fighting the entire food system on your own. And in the United States, that's about a $2 trillion system with a lot of power. And its purpose is to get you to eat as much of as many products as you could possibly eat in as large amounts as you could possibly consume them and pay as high a prices for them as you're willing to do. That's what the system is set up to do, and it does it really well. And it's really funny. I have just come from a departmental seminar by a researcher at the University of California, San Francisco, who gave a talk on um, a group of poor people that she's working with, low income residents of San Francisco that she's working with, on what their problems about eating fruits and vegetables are. And her work is a exercise in why the food system is so difficult. The people that she's working with don't have babysitters. They don't have money for babysitters. They don't have transportation. They don't have refrigerators. They don't necessarily have stoves, pots, pans, colanders, or even necessarily supplies of what running water. I mean, it's astonishing to see what the barriers are, and the barriers are enormous. So if you're telling people on SNAP, the food assistance program, that they should be eating more fruits and vegetables, yeah, they should. But for that, they need money, they need skills, need to know how to cook, and they have to have equipment and time and transportation ability and somebody to take care of their kids. It just goes on and on. Those are food system issues.
And what are the kinds of policy solutions that we think about that could address some of those food system issues?
Universal basic income for starters.
Money, that's one, right?
It's if people the people who eat most healthfully in the United States are people who have money and education.
Yeah, yeah. No, I've always felt, and I'm curious how you think about it, that, remarkably in the United States, we do have a system of supports around food that are pretty remarkable. And people in many other countries, I think, look longingly at the fact that from almost birth to death, there is a food program in this country that, if it was fully funded, if it was really accessible to, its intended beneficiaries, would in fact be very helpful in supporting a healthy diet. 42 million people are on SNAP.
Mhm.
That's a big number. That's
For
a
as
big,
long
big
as
number.
For as long as they last.
for as long as they last. And we have a program for women, infants, and children, WIC, that is a tremendous program. We have senior nutrition programs, we have school meals programs, and yet, people are still food insecure. People are still challenged with healthy food and everything else that you mentioned. And that's always perplexed me
Well, we could
as
do
an
it.
advocate.
Yeah, we could do it all a lot better if we had the political will to do it. And the difficulty, I mean, I like history, and you go back to the English Poor Laws of the 16th century, and the English Poor Laws were based on the philosophy that the poor are poor by choice. That the reason that they're poor is because they're lazy. They don't want to work. They don't really want to do anything. And your job as somebody to make sure that people aren't dying on the street is to make sure that they have just enough so that they don't die on the street. But you certainly don't want to make them dependent on public funds. And what you're really worried about more than anything else is fraud.
Yeah,
And
well,
that was in the English poor laws of the 16th century. You go back and read this stuff, and it sounds just like Republicans today.
yeah, nothing's changed, right? Nothing's
Nothing has
changed.
changed. Nothing has changed. So the idea is, no, you don't want taxpayers paying for other people's children. We're not going to look out for our fellow Americans. And we're going to assume that the poor are poor by choice, not because of accident of birth, being born into terrible situations, or of accidents, or of bad things that happen to them. It's a very harsh view of fellow Americans.
Yeah.
And so you give people the absolute minimum, and you make it as difficult for them as possible to get benefits to which they are entitled. And you make it in every way difficult, expensive, complicated, so that they can't have those benefits. And
One of the things, Marion, that always was surprising to me in terms of the debate over, nutrition programs from school lunch on, is that basically this is a pass-through. In other words, we're taking a coupon or a benefit like school lunch, and it is benefiting another whole sector of our society who are producing that food. In other words, it is a kind of win-win when you think about it. So, the logic of reducing benefits, I don't quite understand where that benefit comes from, because producers are going to lose markets if
well,
those benefits are cut. So supermarkets will lose customers if those benefits are cut.
yeah, I mean, I had a doctoral student who did his doctoral dissertation on how SNAP, which used to be food stamps, went from being a program that was supposed to support farmers to a program that ended up supporting retail grocers. And he traced the lobbying efforts that went into that, and where the food companies were lobbying, and where the grocery stores were lobbying. And when one of the things in his dissertation that was just so amazing to me was nobody was ever asking poor people what they wanted. What poor people wanted was jobs. They wanted jobs, and they wanted jobs that paid enough so that they could support their families on those jobs. They didn't want handouts.
Right. And one of the reasons we have so many people on SNAP, the 42 million, is because
They don't pay them anything.
they're not paying people enough money to live on. Absolutely.
And most people on SNAP are the working poor.
Right.
I
Exactly.
mean, the part about SNAP that just really gets me is the percentage of people who work for Walmart who also get SNAP benefits. That means that public funds are paying Walmart and supporting Walmart,
Yeah, yeah,
for
exactly.
not paying their workers adequately.
Yeah.
There's something wrong with that picture. That's why we need food system change.
That's really, and I do remember a time, at least in my early days as an advocate, was understanding that the alliance of rural producers and urban populations was the alliance that enabled programs like WIC, like SNAP, even like the school lunch program, which benefited at the time from commodity foods to flourish. That agreement was, that bond was unbroken. But certainly, as we saw, this last year with the legislation that passed, Congress, their willingness to cut these programs was, really broke that alliance, I would say. And we're in a whole new environment in terms
Well,
of what
we
people
don't
are
have a
willing.
farm bill, and that's why,
Yeah.
it's
You want to say a little bit about the Farm Bill, Marion? Because I'm not sure our audience really understands it.
nobody does.
It's an
Nobody understands.
enormous thing.
Yeah, nobody understands the Farm Bill, um, because it has hundreds, literally hundreds of programs in it, each one with its own constituency and set of lobbyists. And the President Johnson in 1964 forged an alliance. He could not get the Farm Bill passed, and he could not get food assistance programs passed because there wasn't a big enough political alliance in Congress to pass them. And so he put them together so that urban and rural senators and Congress people would have a mutual interest in making sure that this bill was passed. It was a classic log roll. I'll vote for the Farm Bill if you vote for food stamps. I'll vote for food stamps if you vote for farm supports. And that's how it's lasted for a long time. The Trump administration has broken that allegiance, and it will be very interesting to see what will happen.
Absolutely. And I think, we'll shift into a conversation about the current administration because, RFK was very anxious, I think, to take some control over the food programs that live in a totally different agency than his, because all of our food programs live in the Department of Agriculture. And as we know, RFK is at the Health and Human Services Agency. So while there are certain actions he can take that will influence those programs, his direct control over those programs is pretty limited. So let's jump into where we are in Make America Healthy Again. I think this is, just so challenging for so many of us because early on, and I'll just say this at great risk, there was some words used that might lead you to believe that, wow, this could be something good. I mean, we all were suspicious. I would venture to say that. And I think the truth has played out in terms of our original suspicions. But the centerpiece of so much of Make America Healthy Again was a conversation around ultra processed foods,
Mhm.
as I understand it. And I'm not a scientist or a nutritionist. I kind of gravitate towards you guys for a whole host of reasons. But wonder, talk a little about what is meant by ultra processed food. Why was this a focus of, the MAHA movement? And, what are they doing? I mean, I just see removing, colored dye out of that effort.
Yeah, it's I got involved in it because when President Trump appointed Robert F. Kennedy Jr. as head of Health and Human Services and told him to go wild on food, he said that the industrial food complex was making America sick. And I thought, wait a minute, he sounds just like me. How is this possible? And I should say that Nick Freudenberg, who's a researcher at the City University of New York School of Public Health, and I have just written a piece for Civil Eats on how you think about joining the goals of the Make America Healthy Again movement with the food justice movement, and whether such an alliance is possible. And maybe if I could figure out how, I'll put a link to it in the chat, or we can put a link to it later. But the ultra processed foods they're a fancy name for a specific category of junk foods that are industrially produced, designed to be profitable, designed to be irresistible, if not addictive. And their purpose is to get you to buy them over and over and over again. They're designed to be irresistibly delicious. You can't eat just one. That's the whole point. And they're a specific category of processed foods. And that definition, which was done by a researcher in Brazil, made it possible to do a lot of research. And there have now been literally hundreds of studies of ultra-processed foods and health. These all show that diets that are high in ultra-processed foods induce people to eat more, become obese, develop type 2 diabetes, heart disease, certain cancers, have worse mortality, etc. Those are observational studies, but by now there are 3 or 4 clinically controlled, very well controlled trials that show that they induce people to eat more calories without realizing it. That's reason enough to cut back on them. And Kennedy, in his first statements about what he was going to do running wild, was that he was going to get the chemicals and the chemical additives out of the food supply. That was his first priority, along with vaccination and autism and those sort of things. But on the food side, he was going to get the chemical additives out. And the first thing he did was to get food companies to volunteer to remove their petroleum-based color additives, because those have been linked to behavior problems in kids, and they also induce kids to eat foods that are high in sugar and aren't good for them. And then he said he was going to get the industrial chemicals out of agricultural production, because those chemicals are getting into the blood supply of everybody, in everybody. And in particular, he was going to get rid of glyphosate, which is Roundup, the herbicide that's dumped on genetically engineered corn and soybeans. And he was going to get rid of mercury in fish, which means shutting down coal-burning power plants. That one got a laugh. How's he going to do that? And all of these pronouncements had a lot to do with other agencies within government that Health and Human Services doesn't really have any power over, but he works very closely with Brooke Rollins, who's the Secretary of Agriculture. And Brooke Rollins has said that she wants to get leftist ideology out of the Department of Agriculture. I didn't know the Department of Agriculture ever had leftist ideology, but okay. And I wasn't sure what she meant by that, but I think she means plants.
They are leftist, aren't they?
Plants. If you eat mostly plants, that's leftist, I think. So those were his pronouncements. They were pretty exciting. And I was really interested to see what an opportunity.
But didn't you think, Marion, that if that was really possible, what he was talking about, that the lineup of, industry-sponsored lobbyists at his confirmation hearing would be around the White House and around Congress, that they would never allow it.
But on the other hand, here was an opportunity where there's Kennedy backed up by Trump, who appears to back him up, backed up by the Make America Healthy Again moms movement, which is very powerful, very, very powerful, and very organized and very focused on chemical additives in the food supply because they want to protect their kids from this. I thought there's an opportunity here. Maybe it'll happen. Well, a year later, it has not. And on all of the really big ones, the Environmental Protection Agency is, if anything, is allowing coal burning power plants to do more mercury emissions. They've backed off on glyphosate. They've left color additives to be voluntary. And I was called by a reporter just this morning who said, did you know that Target says they want all color additives out of the cereals they're selling by May, 2 months from now?
Yeah, right.
Well, that's one way to do it.
Mhm.
Maybe the retailers will do it. And there's no reason for the color additives not to go, because these companies sell these products in other countries without petroleum dyes. They've got other dyes they use. So I don't know. There's a lot of hypocrisy.
Yeah, well, I was just going to say for me the almost apex of the hypocrisy was on this glyphosate
Oh, yeah.
decision, where Kennedy sued Monsanto and got a gazillion-dollar judgment because he proved that Roundup caused cancer. And now he is touting the benefit to the American system
Yeah,
of promoting that chemical in
yeah,
production agriculture.
he said American farmers will lose business if we don't let them use glyphosate. Well, I think the word farmers is a euphemism. He's talking about big agriculture.
Oh, totally.
He's not talking about small family farmers. He's
No.
talking about big ag.
Yeah.
And
Yeah.
they're very, very powerful lobbyists. So
No, I mean, there's
everybody else has been subject to lobbying. What a lost opportunity.
well, and I'm happy to see that the Maha moms, right, are pretty angry about this. And I'm not a big, advocate of sort of single issue organizations, but I think in this instance, they are going to really make a lot of noise about, what was the promise?
I
and
hope they
what
do.
happened.
I
Yeah.
mean, Kennedy wrote a long explanation, a very lengthy explanation of why he had changed his mind on glyphosate. And, and he talks a lot about farmers. And I haven't seen any of the Mahamam's responses pointing out that he's talking about as big agriculture as you could possibly get. He's not really talking about farmers. So I'm not, I don't have much sympathy for big ag in this situation. But this was an opportunity, and if he doesn't take it now, when they have so much political support for it, when is it ever going to happen?
It's not I mean, I
It's
don't know, Susan, if we can speak like that, but it's definitely not, I think, in the cards, because industry obviously has the upper hand on these issues. But let me just shift a tiny bit, still in the RFK world, because I'm so curious on the flipping of the dietary guidelines.
I know what's coming.
I mean, I spent, and as I said before, I'm not a nutritionist, but I learned the dietary guidelines. And I really came to understand that pyramid, and hopefully folks on this, in this session are familiar. The dietary guidelines really are the government's recommendations on what we as a population should eat, and has some significant influence over those federal food programs that live in other agencies like school lunch and other things. So what happened to the dietary guidelines? They're produced every 5 years. And I think they're important, but what happened?
Well, the Biden administration appointed by order of Congress, they have to be produced every 2 years. And there are two documents involved in this. There are the dietary guidelines and there's the food guide. Ostensibly, the dietary guidelines are supposed to be for policy for policymakers and nutritionists who advise the public, and policymakers who control school lunches, federal feeding programs in hospitals and the military and such. So they're very important for that. And then there's a food guide for the general public, which has been a plate since 2011. We haven't had a pyramid since 2011. So the process here was that the Biden administration appointed a dietary guidelines advisory committee, which is step one. That committee produces a research report. And then the agencies, Health and Human Services and USDA, jointly produce dietary guidelines based on the research report. Now, that's a big change from when I was on the Dietary Guidelines Advisory Committee in 1995. My committee set the research questions, wrote the research report, wrote the dietary guidelines, did the whole thing. It was a scientific report. We turned it over to the agency, they printed it, pretty much the way we had written it. That changed in the Bush II administration when the agencies took it over. And now the agencies have taken over everything except the research report. So anyway, this committee appointed by the Biden administration produced its report in December of 2024. Then Trump was elected with a rejection of anything having to do with equity or DEI or any of those kinds of forbidden terms. And they rejected the report, the Dietary Guidelines Advisory Committee report, which that committee had spent several years researching and writing. Instead, they appointed a group of individuals to do a review of reviews, each written by one person or a couple of people. And those then formed the basis of the new dietary guidelines, which were announced on January 7th, with the explanation that these would be based on gold standard science and would be free of conflicts of interest. Hypocrisy alert! Hypocrisy alert! So let's just deal with the gold standard science. Instead of a committee dealing with a very, very large number of research studies and coming to a consensus about it, these were one individual's reviewing reviews and writing their own interpretation of it. So much for gold standard science. And as for conflicts of interest, it turns out 4 of the 9 reviewers had ties to the meat and dairy industry, and 3 more had ties to other food industries, which might have something to do with the way the guidelines came out. The guidelines were written by the research report was written by one person, and then we don't know who wrote the guidelines. That's a mystery. Who was responsible for them? We have no idea. The agencies. So the guidelines. Their overall arching philosophy of the guidelines plus the food guide is eat real food. I'm not going to argue with that. I actually like that. And I wish that it had been part of the actual guidelines, but it's not. There are 8 guidelines, and most of them say what's always been said. Balance calories, eat fruits and vegetables and whole grains, don't eat too much salt, sugar, refined carbohydrates, alcohol, restrict intake of salt, sugar, refined carbohydrates. I mean, basically, very, very similar things. There are a few that are different. The one really big difference is a guideline that says don't eat highly processed foods and refined carbohydrates, sugar and refined carbohydrate. The introduction of processing is, I think, a big step forward. I really like that. The Dietary Guidelines Advisory Committee report in December 2024 specifically excluded advice to eat less of ultra processed foods because that committee said the evidence wasn't strong enough. I thought that was a mistake. I thought that was weak of them and that they had an opportunity to make a really strong statement and they blew it. But okay, that's what they did. And so this report makes up for that. I think that's great. So I love eat real food, don't eat too much processed food. That seems highly processed food. That seems really good to me. They use highly processed instead of ultra processed because they think that ultra processed is too controversial. Okay, whatever. So that's what I think the good part is. The weird part, one part was weird, and that is they call for a doubling of protein intake, which is absolutely inexplicable to me because Americans already eat twice the protein they need. Protein is a complete non-issue in American diets. Everybody gets enough if they eat enough calories. And the only reason for doing a recommendation like this is because most people think that protein is a euphemism for red meat. And this is a pushing meat recommendation. They also call for full fat dairy. And again, that's quite puzzling because full fat and skim milk, for example, have basically the same nutritional value. The only difference is that full fat milk has more calories and saturated fat and saturated fat. And why do you want people to eat more fat? I don't understand it. The philosophy behind that is that if you eat full fat foods and eat real foods, you won't be hungry for junk food and you won't overeat calories. And there's a fair amount of evidence that backs that up if anybody could eat like that.
Yeah.
What these guidelines don't do is talk about how you eat like this. So it leaves it entirely up to you. They're based totally on personal responsibility. That's a big difference between the MAHA movement and the food justice movement.
Yeah. And how does it translate when, to those of us, who are just trying to make our way through the supermarket? Is it a non-starter? Nobody's paying attention?
Or don't buy anything in a box. Basically, eat real food. That means you have to cook. You have to, first of all, you have to have the money. You have to know how to cook, which means you have to have equipment, you have to have time, you have to have all those other things that you need if you're going to be cooking. But yes, that would be healthier. I'm all for it.
And what about the protein recommendation as it applies to school meals, for example?
Well, it's going to be more meat in school meals.
And won't that cost more? I mean, school
It'll,
meals are already.
it will cost a lot more, and it will increase saturated fat. And there's a big debate about whether that's good, bad, or indifferent. I think, fat has calories. And so we're going to see a lot more pushing of full fat meat and dairy products. RFK Jr. posed with an enormous steak with candles on it for his birthday. Both he and Brooke Rollins posed with milk mustaches, and so did Trump. And there have been lots and lots of social media posts with them pushing full fat milk.
And you know that yesterday or 2 days ago, the U.S. ice hockey team had lunch at the White House, which was McDonald's hamburgers. And, query if you could imagine that, the trainers for the hockey team routinely give them McDonald's hamburgers or not. I tend to doubt it, but that's what they got when they went for their, celebration at the White House.
Another hypocrisy alert. Those are ultra processed.
Yeah.
So on the one hand, you've got Kennedy's Health and Human Services talking about the need to reduce ultra processed foods, which I'm all for. And on the other hand, you've got the president modeling a very different kind of diet. So if people are confused, it's understandable why they would be confused.
Yeah.
And how school meals are going to adopt these guidelines, I want to see, because the school lunch program is so badly underfunded already that I don't see where they're going to get the money to do this.
Yeah, and it's interesting to me, and I'm just watching our time because I want to talk a little bit, a second about supplements and another second about the Berkeley soda tax, since it's coming up again, whether there's going to be a tax. And, uh, the school meals is so important. It is often the only meal that many children get in a day. That, the challenges to that program, we saw in the Michelle Obama years. I think, Marion, you'll remember the enormous pushback, uh, just for trying to get salt out of the school
Nanny
meal
state,
program. We were
nanny state.
accused,
Mhm.
just relentlessly. And honestly, I don't see the same kind of
Mm.
pushback. I don't see people
No,
paying attention.
that's one of the reasons why they have this incredible opportunity, because there isn't that pushback.
Yeah,
But it shows you how politicized that was. That was a Republican pushback.
yeah.
And now the Republicans are doing it and they're not pushing back. If the Democrats were trying to do it, I guess it would be nanny state.
Right.
It's a,
And I'm so sure Michelle Obama didn't imagine this was going to be the controversial issue it became.
oh, I've always wondered whether she knew how controversial it would be.
Yeah.
But and she was trying to make, and in fact did make, some very substantial changes in the nutritional quality of school meals. And I would like to see that same level of attention come. But the school meal program has been so seriously underfunded.
Yeah.
It's very hard for me to know how they're going to do this.
So
Uh,
let me ask you because my dearest friends in the nutrition world will be very angry at me if I don't ask you at least one question about supplements and whether or not, this sort of onslaught of supplements are helping us or hurting us. It's a largely unregulated industry, and just, you know, kind of what your thinking is about the utility of supplements in our diets.
well, I'll go on record. I don't take any. Um, the they're so interesting because more than half of American adults take supplements of one kind or another, despite the almost total lack of evidence that they make healthy people healthier. And the more than half of Americans who take supplements are the healthiest people in our society. They're people with education and money. The people who might actually benefit from supplements are not the ones who are taking them.
Because they're too expensive.
They're expensive and you don't know what they are. And yeah, you don't know what they are. And you don't know what they are because they're by federal law unregulated by the FDA, largely unregulated. And the studies that have been done of them show, and there's a private organization, Consumer Lab, that does this all the time and is constantly testing categories of supplements and showing that what's on the label has almost nothing to do with what's actually in the product. So if you're taking a supplement, it's a crapshoot. You don't know what you're getting. Fortunately, they're not very harmful. So most people, there are very few examples of people getting sick from them, which is good. And they're a fabulous placebo. They absolutely make people feel better. And in today's society, if all it takes is a supplement to make you feel better,
Not bad.
it's really hard for me to argue against.
That's very funny.
So I tend not to argue against supplements. It's just that when people show me their tables full of bottles, I roll my eyes. But people feel better if they take supplements. That's absolutely true.
Do you think people forego, prescribed medicine?
Oh, yeah,
Is that a risk?
Yeah,
Is
some
that a risk?
people do. And we're in a wellness influencer period of our history right now. And the Maha movement is very much a wellness influencer movement. And they are pushing all kinds of products that usually don't have any better evidence behind them than anything else. Or if they do have evidence, they bought their own evidence.
So before I look to Susan, because I know there's a lot of questions in the chat, and we're running out of time, but I have to kind of hone in on closer to home. And, we have a Berkeley soda tax. I think at least the research I've looked at, the evaluation, it has had a pretty significant impact on the consumption of sugar sweetened beverages. And I just wonder, I guess it's a quick two-part question. One, what do you think about that kind of policy, of
I think we should be doing it everywhere. I think we should be doing it everywhere. The other issue about the Berkeley soda tax is, to my knowledge, the Berkeley City Council has done exactly what it promised to do with the funds from that that are coming in from that tax. And that's just been terrific for child health programs.
Right. No, I think they've raised well over $1 million, maybe more,
a year,
that go directly, into programs like child nutrition programs.
Yeah. So if I were in Berkeley, I'd vote for it. For sure. And
what about the limitations on soda purchases in the SNAP program, which a lot of advocates felt was nanny state, but I think we've seen that increasingly in the last year.
Yeah, there are 18 states now that have done that. I've always felt that it was worth a pilot project. Let's do a pilot project. And the reason that I felt that is that when I wrote my book, Soda Politics, I got letters from people who said, I used to be on SNAP. I found SNAP to be an incentive to buy sugar sweetened beverages. When I went off of SNAP, I didn't buy them as often. Okay, let's do a pilot project and let's see how the restriction affects people's private purchases of sodas, and let's poll SNAP recipients to find out how they feel about it. I thought that was information that we absolutely should have had. I thought the Department of Agriculture was wrong to refuse requests for such pilot projects. There was one in New York. They turned it down. I thought that was wrong. I think you can argue the restriction on SNAP either way. You can argue public funds should go for demonstrably unhealthy products. And sugar sweetened beverages are really the only one besides hard candies.
Yeah.
Everything else has nutrients in it, but sugar sweetened beverages don't. So it's a sort of a clean project, and a clean product in that way is that it has no nutritional value other than calories and dumping large amounts of sugar into your system very quickly. So I think they're worth restricting. And I think the argument that public funds should not pay for unhealthy sugar sweetened beverages is a reasonable argument. I also think the condescending nature of it and the fact that you're picking on SNAP recipients also needs to be questioned, because, why are poor people being singled out for further isolation and in some maybe perhaps punishment, but that it was worth a trial. Okay, right. We're going to have that trial. There's research attached to all of those programs.
Right. So or assuming that SNAP recipients are not making otherwise very healthy choices, right. Which I think they are. Well, I do have one other last big question, but I want to just turn to Susan and see if something has come up in the chat that she thinks we should be tackling. I'm sorry we didn't leave more room for that, but there's just so much to cover. We probably need another session.
Absolutely. And no, I mean, I think we're learning a tremendous amount by not interrupting it with other questions, but
Besides, we're having so much fun.
Well, I'm so glad, it's wonderful. And it conveys the pleasure in knowing what is the correct way that things should be taking place? I'm going to try to capsulize a couple of different questions and throw them at you. One is to find out if either of you know anything about the current litigation that's happening around ultra processed foods in San Francisco.
Only that it exists.
That it is there. The other question that is emerging among several people is partly the, one might say generously ironic, that we have the position that it's the personal responsibility to make these choices when what the choices are addictive. And so how do you begin to talk with people? And I mean, how does the Maha Moms deal with that? Around the fact that this really does require, if not a nanny state, more education and more policy around.
Yeah, they're not terribly policy driven. They want food companies to, let's talk about color additives. They want food companies to stop using petroleum dyes in their food products. And they're angry with the food companies that are continuing to use those dyes, even though they think the dyes are unhealthy. But they're not pushing for federal legislation to stop the companies from using those dyes. They're very happy that the states are passing laws, and maybe the states will drive it. And if enough states have laws, and those laws are sufficiently inconsistent that food companies can't manage, you can't make different products for California, Nebraska, and New York. You just can't do it. That maybe that will force preemption. And then, of course, food advocates are very worried because preemptive laws tend to be very weak. So we're in a very interesting situation right now, and I don't know how it's going to come out.
Well, and I think as you
except that the personal responsibility argument is one. If personal responsibility is what you care about, then the only thing that the government has to do is educate. It doesn't have to restrict anything that the food companies are doing. All it does is have to educate you. And that's where the difference in attitude becomes so profound.
Well, it's also, it'd be interesting to plumb further around Target as a retailer, why they made the decision that
I don't know why they did.
I mean, I think about the fact that they are Dayton Hudson based in Minneapolis, Target, the corporation. At any rate, Minneapolis is on my mind. As being heroic in many things, and whether or not there was a population that they were responding,
I really don't know. The reporter, I told the reporter this morning that he needed to find that out.
Oh, good. All right. Well, we'll look for that for sure. The other question then has to do with, it's Nana Rogers' question around the potential of emerging food technology, the plant-based cellular agriculture, fermentation-derived proteins, a replacement for traditional animal agriculture. Are you encouraged by this, or is there what's on the horizon for this? Do you think it's a good thing? Can it be supported with policy?
Crystal ball. I don't know what's going to happen. In general, a lot of people don't want to eat this stuff. These are techno foods, and they don't want to eat them. They're ultra processed. That's a problem. The venture capitalists love them, but consumers don't. So I don't know what'll happen with them. There are a lot of technological problems involved, particularly in the cell-based meat cultures, which at least might taste better. We just have to see. I think it's too early to say.
Too early to know. All right. And then one final set of questions. I'm going to pitch this to you quickly. Confusion about the value of a couple of supplements, vitamin D3, vitamin C, and then a question about the best buy dates.
About the what?
Best buy day.
Oh,
Yeah.
oh, really? Yeah. I think the Best Buy day for milk is really, really, really important in New York. You buy milk one day later and it's gone. It's
Got it.
sour. On dry packages, it doesn't make much difference.
Yeah.
And it does lead to food waste. Um, on vitamin D3, that's a big, complicated question that has to do with how vitamin D deficiency is diagnosed. And I think the test for it cannot possibly be right because surfers in Hawaii have been found to be vitamin D deficient, and I don't see how that's possible. I just don't see. The best source of vitamin D is sunlight on skin.
Right.
And as I said, I don't take supplements.
Wow. Well, listen, I thank you very, very much, both of you. And I know, Marion, you had one more question.
Want to throw it in quickly?
Yep.
Oh, I just was going to say, what are the top three big policy, if you had to say, what should we be aiming for? What are the top three? I mean, I was going to say five, but we only have time for the
Okay. Overturn Citizens United and get money out of politics. Universal basic income, universal school meals.
All right. Marion, you're the greatest. Thank you so much. We really look forward to having you here in the Bay Area. You have so many friends. We can have a great dinner party somewhere.
Invite me. I'll come.
All right. It's a
Thank
date.
you, both of you, and thanks everybody for coming today.
Thank
All
you,
right.
Susan.
Bye-bye now.